Welcome to Dr. Chuck Sepers. Chuck has served as the health officer and director of Appleton Health Department since February 2022. With over 15 years of experience in public health, his work centers on understanding and improving the factors that influence health and well-being. He's particularly dedicated to working with communities, especially underserved populations facing health disparities. Prior to his role, Chuck focused on improving access to healthy food through community-based interventions in rural Nebraska and urban areas of Northeast Kansas. Now in Appleton, he's committed to addressing the needs of the city's diverse population. Chuck holds an Associate of Arts degree from Central Community College in Grand Island, Nebraska, a bachelor's degree in psychology and exercise science from University of Nebraska, a master's in public health from the University of Kansas Medical Center, both a master's and doctoral degree in behavior psychology from the University of Kansas.
All right, really, thank you, Gwen. Want to thank the Appleton Historical Society for having me here. And ready to talk about a really engaging topic, death and disease. And so this did force me to get into and learn a lot about the city of Appleton, having only been here about 3 years. So a fun project for me too. So I just want to start off by talking about what public health really is in general and sort of the role it's played. And that's really going to be the lens in which we view this. It's not going to be a statistics-heavy presentation. I'm going to make the topic of death as engaging and as exciting as I possibly can, and I apologize for that. So that was a joke, and please feel free to laugh. So public health has been critical in blunting the worst of deadly epidemics that we've seen, transforming potential catastrophes into manageable threats. We've had some long-term and recent examples of that. But today's fight against a preventable disease is increasingly being fought upstream, targeting environmental risks, social determinants, and policy-driven factors. Over the past 100 years, advancements in public health and vaccinations have greatly reduced the unnecessary deaths from infectious diseases like TB and influenza. Yet as these threats wane, preventable, non-communicable diseases driven by environmental factors and social factors have taken center stage. Join our conversation on death and disease in Appleton, a journey through Appleton's ever-changing focus on health and well-being for everyone. All right. I love this quote. I always think about this quote from Dr. Michael Marmot. It captures the essence of public health, healing communities, not just individuals. With that lens, let us dive into our city's history. We're really going to break things down into these 4 sections. We'll talk about really the times around the founding. All of you are well versed in the history of the city of Appleton, well more than I am. So I'm not going to tell you anything that you don't know, but we're gonna keep that very brief. Talk about some turning points, some milestones that we need to point out. And that shift. So I won't spoil all the fun, but really we saw a shift in what our population focused on as we think about health and really public health. And then we'll talk about what public health is now, that modern approach and sort of future trends. So with that, the early period. So in 1847, Appleton was settled. Early infrastructure quickly emerged, including paper mills and a hydroelectric plant, as you all know. But sanitation lagged behind and disease flourished, as it did everywhere, right? So the thing about flourishing cities is that people are crowded together, and that creates some of those conditions, right? So again, in 1847, the city of Appleton was incorporated into a village in 1853, which also coincided with the first paper mill. The paper industry was the primary economic driver, again, as many of you know, spurring the development for the next 150 years. Unknown to many was that in 1882, the first hydroelectric central station in the U.S. was built in Appleton by Thomas Edison to supply electricity for the rapid expansion for the local paper industry, and that it did. That expansion directly had contributed to more people settling in the area and further spurred local economic growth and highlighted the need for wastewater treatment. The paper industry would continue to be a major contributor to Appleton's wastewater stream until the early mid-2000s, when many of the area facilities decreased production, relocated from the Fox Valley, or closed. In 1883, a combination sanitary and storm sewer was constructed to serve the rapidly expanding city. So that combined sanitary sewer lacked any form of treatment and had directly dumped untreated waste into the lower Fox River. Just a few photos here. None of these are from our archive, but you know, a good view from what is now the old Oneida Bridge, the Vulcan Street plant, which was the first hydroelectric plant, and then that's from the Newberry Trail, looking towards the flats. That bottom photo, and not sure on the dating of that bottom photo. Thinking 20s or 30s. 30s or 40s perhaps, but you can kind of see that's not necessarily a body of water you might want to spend time in. So at that time. So as we think about what diseases were affecting people in that early era, diseases like cholera, malaria, typhoid, really were the three that had dominated that era. So medical knowledge was very basic, and most people died from things that we can now easily prevent. But things like germ theory were not something that we thought much about, didn't know about at that time. So if we think about malaria and how it affected those in the state of Wisconsin, military posts in the Wisconsin frontier from the 1820s to the 1830s usually had a hospital and a surgeon's quarters. Through the service was often poor and adequate at that time. At Fort Crawford, 154 of the 199 men stationed there in the summer of 1830 had malaria. Even so, despite its high occurrence, few men actually died. Cholera, on the other hand, was far more dreaded, and the spread of that disease happened at a frightening speed and exacted a far higher death toll in the state of Wisconsin. So according to the U.S. Census Bureau, 45.7 out of every 1,000 deaths had occurred from malaria fevers in 1850, to give you some sense of scale of that. Malaria also ravaged the troops in the Union Army from 1861 to 1865, its fevers killing about 10,000 recruits through the U.S. Civil War. Typhoid fever, or a form of salmonella, is an intestinal disease caused by contaminated food or water. Conditions in camp were perfect for the spread of disease like typhoid fever. The lack of sanitation, improper placement of latrines, and general lack of knowledge of bacteria and germ theory caused sickness to thrive. I mean, if we can't even see it, how can it make us sick, right? And that was the thinking of the time. In 1850, 300 Norwegians and Swedes, most of whom were infected with typhoid fever, arrived in the Milwaukee area aboard the ship the Allegheny. In the absence of sewage systems, clean water, and a systemic street cleaning, the effective methods for keeping and preserving foods, waterborne and airborne diseases were constant threats throughout the state of Wisconsin. There were 75,148 documented cases of typhoid fever, with 27,058 deaths within the Union Army, just to give an understanding. Cholera, we'll talk about that one separately. Does anyone know who this gentleman is? John Snow? We've got one hand back there. Very good. John Snow is considered to be the founder of public health. Didn't know anything about germ theory at the time, but in the mid 1830s, prior to the founding of the city of Appleton, cholera was running rampant through the city of London. Okay, and John Snow was very scientifically minded, a physician, wanted to understand what these folks had in common that were dying. And so John Snow led a very detailed census of those that had died of this cholera outbreak. And so you can see that heat map there on the lower right. Those are obviously the hotter areas are where more people had died based on the address. And then you see kind of a very interesting area there. I don't know if you can directly see it, but if you look at the bright yellow and then move about 2 blocks over to the right, you can see there's not many cases, or I should say those that had died. And so we're curious about that. And these are the sorts of questions that John Snow had asked. There's a brewery in Broad Street near the pump, and no brewers' men were registered of having died of cholera. Above 70 workmen employed in the brewery, none of them had suffered from cholera. At the time, a disease had actually prevailed. The men do not drink water at all. There is a deep well in the brewery in addition to the new river water. So without drinking water, they're drinking beer, they're drinking mead. They did not get sick. And so this gave John Snow a bit of a thought. I wonder if it's the water itself that might be making folks sick. And we won't get into the methodology, but we were starting to see those cases actually go down about the time John Snow had marched up to the Broad Street water pump and pulled the handle off. As you can see from the map, most people that were around that water pump were those that had died. And so just a quick view of what that early epidemiology looked like. Communicable diseases were the dominant killers of this time. Few lived long enough to develop a chronic disease, things that we think about now, cancers, heart disease, those sorts of things. And most deaths weren't preventable based on the tools that they had at the time. The success of early public health system to incorporate biomedical advances, vaccinations, antibiotics, and to develop interventions such as health education programs did result in a decrease in the impact of communicable disease over time. However, as in the incidence of these diseases decreased, chronic diseases such as cardiovascular disease and cancer, as we talked about, had increased. And in the last half of the century, public health identified the risk factors in many chronic diseases and intervened to reduce the mortality of chronic disease. So here, you can't see this, but if you could, it would indicate this is a Sears catalog page showing all the different crazy things that people would take at the time. And so just marketing, literal snake oil to people that were, developing these maladies, as it were. Next slide. So again, more of the same. This is a photo of a sort of common kit, many different drugs, many different opportunities to fix anything that might ail you at that time. We did find that rest, hygiene, and the learning about germ theory slowly reshaped how people thought about their world. But it wasn't until the infrastructure, clean water, sewers, and garbage collection caught up with our modern technology, we saw that meaningful change in public health. By the 1870s, smaller doses of more effective medicines and the recognition of the importance of rest and personal hygiene, as I mentioned, really became popular. All right. So by the early 20th century, we saw the city of Appleton really boom. This is a plat map from the year 1900. I was able to find my house on the map, so that was very nice. That's why I used this one actually. But yeah, so we were really expanding. Go ahead and let's go to the next slide. Until we couldn't. So it became evident that to Appleton area residents, as well as the state of Wisconsin, that by the early 1930s, that the growth of the community was negatively impacted by the water quality of the Fox River. During this period, the Fox River had become so polluted that it was unable to sustain the habitat of its native fish and wildlife species. Outbreaks of cholera, typhoid, and dysentery made it apparent that, and again, even after we were working on some of this, really made it apparent that Appleton needed to provide a means of treating the city's wastewater. On March 13th, 1935, the state sanitary engineer, as well as officials from the State Board of Health and the State Water Pollution Committee, had presented Appleton with a request to start action toward the elimination of pollution into the Fox River. On May 15th, 1935, city officials take the first steps towards construction of the wastewater treatment plant when they agreed to hire the engineering firm of Greeley and Hansen. On November 9th, 1935, the city council had agreed to start construction of the facility. Located on the south bank of the Fox River, the first Appleton wastewater treatment plant only provided primary treatment at that time, but represented a significant step forward to effectively serve the rapidly growing industry and alleviating the pollution into the Fox River. Also during this period, of course, was the Spanish flu outbreak in 1918. The 1918 flu was swift, deadly, and chaotic. It killed more than 675,000 Americans and many young adults, often in a very short amount of time as well. Quarantines, school closures, and social distancing mirrored what we lived through during COVID-19. The 1918 pandemic, commonly called the Spanish flu, had profoundly impacted Wisconsin between September and December of that year. Approximately 103,000 residents fell with influenza and related pneumonia, a complication of the influenza, leading to 8,459 deaths, a toll surpassing the combined number of Wisconsin casualties during World War I, the Korean War, and the Vietnam War put together. Distinctly, Wisconsin had implemented aggressive, uniform public health measures to combat the epidemic. On October 10th, 1918, State Health Officer Cornelius Harper mandated the closure of all schools, theaters, movie houses, and other public gathering places indefinitely. This decisive action, coupled with public compliance, is credited for reducing the state's mortality rate to 2.91 per thousand compared to 4.39 per thousand nationwide. So almost half there. The pandemic's severity was exacerbated, of course, by World War I, which had facilitated the virus's spread through troop movements and crowded military camps. Notably, the University of Wisconsin-Madison's Student Army Training Corps experienced significant outbreaks due to the congested living conditions there. Despite the health crisis, the Student Army Training Corps activities had continued and had reflected the prioritization of the war effort, even amidst the Spanish flu outbreak. That's all we'll say about that. Let's go, and I'll just talk about this photo. This is actually from our box of photos. I don't have any information about this, including the time period, but it does appear to be 40s to 50s. And I think it's probably still in a cabinet in our office. So, yep. Okay. So this slide indicates from Winnebago County, you can kind of see the effects of the outbreak in terms of deaths. So again, this is focused on Winnebago County only, but you can see that in comparison to the years following the Spanish flu, death by influenza was very high during that year. But again, if we compare those Wisconsin numbers to our national numbers, they're quite a bit higher. And then just over on the right, just that same graph, just for the year of 1918, and it's broken out by men and women. So a few other things to think about in the 1900 to 1950 period, we think about TB and polio, two things we don't think too much about these days. It's a bit of a public service message. No spitting. Good advice still. Like if if someone asks you what you might do during cold and flu season, not spitting is good still. 1 in 7 had died from TB this was in the state. So most people had given a little attention to things like spitting or that social distancing, all the things that are probably not as socially validated today. At the end of the 19th century, 1 in 7 people around the world, this is the global number, had died of TB, and the disease ranked in the 3rd leading cause of death in the U.S. While physicians had begun to accept German physician Robert Koch's scientific confirmation that TB was caused by a bacteria, this understanding was slow to catch on amongst the general public, hence the spitting. And most people gave little attention to the behaviors that had contributed to a disease transmission. They don't understand that things that could make them sick, again, with the spitting. In his book, TB, Its Modern Prophylaxis and the Treatment in Special Institutions and at Home, S. Adolphus Kampf, an early TB specialist, practiced medicine in New York, wrote that he had once observed several of his patients sipping from the same glass as other passengers on a train, even as they coughed and expectorated a good deal. It was common for family members or even strangers to share a drinking cup. And I'll say that during COVID, that was a thing that we experienced quite a bit in our contact tracing efforts, as folks had indicated that they had shared cups. So how much we've learned, I'm not sure. Yeah. Okay. So with polio, just a brief mention here. So in the late 19th and early 20th centuries, frequent epidemics saw polio become the most feared disease in the world. A major outbreak in New York City in 1916 killed over 2,000 people, and the worst recorded U.S. outbreak in 1952 killed over 3,000. Not long afterwards, in the early 1950s, The first successful vaccine was created by the U.S. physician Jonas Salk. Has anyone heard of Jonas Salk? Yeah. Polio. So Salk tested his experimental killed virus vaccine on himself and his family in 1953, and a year later on 1.6 million children in Canada, Finland, and the USA. Results were announced in April 12, 1955, and Salk's inactivated polio vaccine was licensed on the same day. By 1957, the unusual cases had dropped from 58,000 to 5,600, and by 1961, only 161 cases remained. So the history of the public health infrastructure. So although some cities had local public health boards by the 1900s, no county health departments had existed. So during 1910 and 1911, the success of a county sanitation campaign to control a severe typhoid epidemic in Yakima County, Washington, created a public support for a permanent health service, and a local health department was organized on July 1, 1911. Concurrently, the Rockefeller Sanitary Commission began supporting county hookworm eradication efforts. And by 1920, 131 county health departments had been established nationwide. By 1931, 599 county health departments were providing service to 1/5 of the U.S. population. 1950, 86% of the U.S. was served by a local health department. And about 35,000 people were employed full-time in public health agencies. The federal government took a little different path, having started about 1800. But you can see the CDC came online in 1946, but had roots back to Benjamin Franklin in 1798 from the federal perspective. And these are just a few photographic records of some of the rates that we had seen. So chicken pox, not something that we see at all these days. It was interesting. Measles, unless you're in Texas, this is not something you would typically see. Mumps, rubella, and again, these are things that really plagued the city of Appleton and other areas at that time, but these are virtually gone now because of our vaccine efforts nationwide. Let's see. Next slide is more of the same. Next slide is the bulkhead, and so next slide. So back to the Fox River. Everything goes back to the Fox River. So I won't spend a whole lot of time on the map, but you can see these are basically stages of these sort of cleanup efforts. And on the left side, you can see the sort of unfolding of the environmental decline of the river, and then those efforts to bring us back to the pre sort of paper mill era, right? And so I thought that was a neat graph there. So we talked a little bit about the communicable disease piece versus the non-communicable. And again, this is where we start to see a shift. So things like the environment and policies really play a much greater effect on health as we begin to move into the last half of the 20th century. And so by the 1950s, a profound transition had occurred of that type. We see that transition. Soon after that transition, however, the prevalence of chronic diseases began to steadily rise among the dominant cause of illness in the U.S. This is a photo from, looks like the possibly early 70s, and this was the Appleton Health Department. It's April 24th, 1976. So if I could just read the photo. This is a display at the People's Fair. I don't know what that is, but many of you might know. So So by this time, the WHO had come online. People were learning more and more about public health practices, washing hands, those sorts of things. Germ theory was widely established, and that's all I'll say about that. Let's move on. And then just to kind of show so if we zoom out and look at the effects of all of these public health efforts over time, you can see that the life expectancy did climb and climb very steadily. So this is going from 1960 all the way here on the left. And the dotted line indicates where we are now in 2025. We can see an increase of about 11 or nearly 12 years of life expectancy. And a lot of that is policy driven, right? And this is just a indication, and this goes back a little bit further. This is 1930, but same sort of idea. Next slide. Next slide. All right, modern approaches. What do we do about all this? We've got chronic disease now. It's no longer TB and dysentery. Next slide. We're starting to clean up the Fox River. That's not an effect. There was a little thing called COVID-19, and this chaotic graph, which looked a lot better on paper, sort of indicate. If you look at that blue line, you could just see the incidence of cases. There's death rates in there as well, but every one of those dotted lines indicates some sort of effort. So a Wisconsin Safer at Home order all the way there on the left to sort of the beginning of 2022, where we saw the last large bump, right? I was looking at, and we'll see them, but again, if we don't get that far, the number of deaths for COVID-19 in 2024 were 3. That's a huge change from where we were in 2022. So, and those are some death graphs over on the right-hand side, so you can see very few. So you see that large spike, at the very start of the COVID-19 pandemic, and this is really due to those that were being tested, had a high symptom load there. So we're seeing that if you were tested, you were identified as having COVID, those people were very sick, and so that's why you see it higher. But you see it sort of level out once we get to the end of 2020. But and then that bottom right graph just indicates the percentage of those over the period of time from 2020 to 2022 in the city of Appleton that had died by age category. So those of a more advanced age were at a higher risk, so we saw a higher percentage. So while we're working on those things that are affecting us from a more chronic disease basis, these are still things that we have to consider. All right, next slide. I'll stop talking about COVID now. I promise. So this is the part that really makes me really excited. So if we think about what public health is now and where it was, what we call public health 1.0, or that period of time from the late 19th century through much of the 20th century, when modern public health became an essential government function, with specialized federal, state, and tribal public health agencies. During this period, public health systematized sanitation, improved food and water safety, expanded our understanding of diseases, developed powerful intervention and treatment tools such as vaccines and antibiotics, and expanded the capability in epidemiology and laboratory science. This scientific and organizational progress meant that comprehensive public health protection from effective primary prevention methods through science-based medical, treatment and tertiary prevention was possible for the general population. And so that was public health 1.0, and we still do much of that. And then that public health 2.0 was really the alignment of having public health be the provider of last resort. So public health is not healthcare. However, public health serves some healthcare functions when it needs to. And one good example of that is our vaccines for a children program. So for those children that qualify for Badger Care, they can get a free vaccine through their local health department. And there are many providers that also provide that program as well. Next slide. So we're also looking at, so then what is public health 3.0, right? So we're no longer, I should say, those that are cleaning up the Fox River, those that are building streets and expanding sidewalks and all of that happens to be public health too. And that is really where public health is going. So rather than providing vaccines for large numbers of people or providing free health care or some of those other things that public health had done in the past, we are focusing in a different way. And so this graphic just sort of indicates those three areas. So there's primary prevention. So that's what happens if we can prevent someone from getting sick. And then there is the secondary prevention or screening, and we also do that too. And then there's the tertiary or third stage prevention, and that's where healthcare is. And so healthcare prevents people from getting sicker. Public health prevents people from getting sick, and that secondary piece is where public health and healthcare kind of meet in the middle. Next slide. And so these are some of the things that we would typically focus on, right? If we look at the top reasons of death, there's cardiac events. So we would ask people to be screened for high blood pressure, increase cancer screening, all of these things. Next slide. This one's pretty clear, and this illustrates my point. So all those things that we're asking people to do, that is that individual level, effort, right? You have all of these other things, and so at the personal level or the individual level, is knowledge, attitude, skills, and behaviors. But then you have those friends and family around you. You've got your workplace, those that you play bingo with, all of those things, and then all the way up to federal, state, and city policies. Smoking laws, seatbelt laws, all of those things are examples of that. Okay, next slide. So without focusing on thousands of cases of chickenpox in the city of Appleton, there are things that we do have to work on, and so the idea of the 5 social determinants of health are that, and it's hard to see, but just to understand, if we move upstream, so if we ask, but why? Right. So why is someone experiencing an unhoused context, or that they do not have access to health care or something like that? It falls within one of these 5, and that's the education and access to a quality context there, healthcare, neighborhood and built environment, social and community context, and economic stability, right? So those are the things that we consider as the social determinants of health. Those are things that affect policies. Those are things that, as policy can affect those things. Those are the things that affect health more than that individual circle. Next slide. This is a expansion of that. This is what we call the 7 vital conditions, and this is now the sort of federal framework for how we think about health and well-being. These 7 vital conditions, which are transportation, thriving natural world, civic muscle, sense of belonging, housing, so on. These are things that we know from the science that if people have these 7 conditions, they thrive. So the more you have in combination, both in number of and the amount of, the more likely people are to say that they live their best life. And so that's what that is. Next slide. This is another model moving past where we were in the previous model, which was about 2020. This is a 2022 model. So we have all those 7 vital conditions on the left side. We also have these urgent services in gray on the right side, and these are things like acute care for being ill, or environmental cleanup, homeless services. These are things that are needed, but they are also not. It's not possible to get to thriving by only doing those downstream efforts. So while we need to look at crime, we need to also address the things that create the conditions of the thing. Next slide, please. So some of the things that we're working on, now, and these are just some examples. I say we, us, locally, but also in the region, in the state. But one big focus is a sort of harm reduction strategy. So the Naloxone program is one that provides an opportunity for those that have experienced an opioid overdose, that provides a means in which they can overcome that. That's an example of a harm reduction strategy. And again, in the interest of time, we'll just go ahead and move to the next slide. Start to wrap up. Lead Safe Homes program. This is a federal program that the state of Wisconsin services, and one that we are a part of. And this is basically the idea that those that have those children with a high blood lead level, there's no safe exposure level to lead, but this provides a funding mechanism for those homeowners to have those homes cleared of that lead hazard. So that's a program that we participate in. Just to give just a rough example. Next slide. I talked about smoking policy. We've recently expanded the no smoking area from the downtown transit center to include the new library block. And so there was all sorts of fun of legislative history with that, which we'll go ahead and skip in the interest of time. So next 2 slides, we'll skip that one. But and then these are some data. These are some local data that we have. So the one on the left, this is from our latest community health assessment, which is not out yet, but you're getting a preview of what those data are. This is our point in time count, that graph on the lower left, and that just indicates the number of those that have experienced homelessness on the night of when the count was done. So the blue line, those are summer counts, and that's 148 in the summer of 2024. We see a large uptick from the previous summer, and then we see the same thing in 2025. Part of this is we are seeing a large increase in those that are experiencing in unhoused context, but we also changed the way in which we count them. And so these are more accurate counts, but we're also seeing a large increase. Just to understand that, and we didn't go into this very much, but just to understand that outcomes for population health outcomes are different for different populations. There's different exposures, there's different outcomes, and the graphic on the right indicates some data that came out of the Northeast Wisconsin mental health connection, and so this was from their Mind Their Wellness survey, which was published in 2022, I believe. So this just indicates that the BIPOC community is 3.1 times more likely to report suicide ideation. Now, what goes into that? Those are questions that help influence what the sort of interventions that get pulled out that we work on, not only as a local health department but as a region. So. Next slide, and I think we're close to wrapping up. Since we are talking about death and disease, I thought it would be good to pull. Again, this is from our 2024 annual report, which is not out yet. So these are some hot off the press vital statistics numbers. So we go back to that chronic disease piece. So 182, or the leading cause of death, is those related to the heart, followed by cancer, so on and so forth. Accidents, which are surging again, that's interesting, 24. But if we go back to this number, this COVID-19 number, we're at 3. So 3 people that were living in the city of Appleton in 2024 had died of COVID-19 in comparison to where we were. So that in of itself is a exciting number. Thank you.